So after understanding the external nasal framework and the diseases that can happen in the external nasal framework, we are going to go inside the nose today and study a little bit about the part of the nose that divides the nose into two cavities, that is your nasal septum. So nasal septum ये बीच वाला पार्ट है जो हमारे दोनों नोज को लेफ्ट एंड राइट कैविटी के अंदर में डिवाइड करता है. Before understanding the different diseases of nasal septum, let us understand how this septum is arranged and what is the development of this septum to understand कि deviated nasal septum हो गया या epistaxis हो गया, वो सारी चीजें क्यों हो रही है. The first thing let us understand is the anatomy. We are looking at the septum from the side way. So this is a sagittal view of the nose. What we can see over here, what is this structure? This structure, what was forming this columella? This columella was being formed by the lower lateral cartilage. So we had seen yesterday that the lower lateral cartilage forms the tip of the nose and the columella. So this is your columella. And if this is your columella, this is called as the columellar septum. This is called as the columellar septum. All right. Now, after this columella, you can see that this is the septal cartilage, right? But in between this space, can you see this space? This space which is between the columellar septum and the septal cartilage is devoid of any septum. Now, all of you can also check right now. You can just move your columella and you can feel that there is an area in front of the septal cartilage which has got absolutely no cartilage. It's only skin of the two sides which is fused to each other. And this is called as your membranous cartilage. This is called as your membranous cartilage. All right. And then you have got your septum proper. This septum proper has got two parts. You have got a cartilaginous septum and you've got your bony septum. All right. Cartilaginous septum is formed by the septal cartilage. We had seen yesterday septal cartilage is which type of cartilage? It is a hyaline cartilage. It's a hyaline cartilage. You can also feel it is not very easily mobile. What you can move is only the columella. अंदर के septum को हम नहीं हिला पा रहे हैं. So it's a hyaline cartilage, and this hyaline cartilage is unpaired. So it is one unpaired cartilage of the nasal framework, right? How about the bony cartilage? Bony septum. Bony septum is formed by the ethmoid bone and the vomer bone. So now this ethmoid bone is more like a M-shaped bone, where it gives contribution to the lateral wall of nose, to the septum and to the skull base. All right, so it's differentiating your nose from the anterior skull base. So this is your ethmoid bone. This is called as perpendicular plate. So if this was the ethmoid bone, this is the perpendicular plate of the ethmoid which is forming a septum. इसके नीचे है हमारा vomer bone. Which bone? Vomer bone. So this is your vomer bone. So nasal septum, if somebody asks you, just don't say it is septal cartilage and vomer and ethmoid. It also is formed by the columellar part of the lower lateral cartilage and also a small part which is devoid of any cartilage or bone, that is called as your membranous cartilage. All right. What is the significance? The significance is when we will study in 5 minutes about the septoplasty and SMR. So during surgery, where to put incision, how to put incision, what are the key things you have to keep in mind, we will talk about shortly. Now, once we have understood the different parts of the septum, before we go ahead into the details of the diseases, we will talk a little bit about the development. If you remember, yesterday we had talked about the bony part, I mean the skull, and we talked about that this is the pyriform aperture, and this pyriform aperture is formed by mainly the bony parts, right? So there is a nasal bone, this is the nasal bone, and you have got a perpendicular plate of ethmoid and vomer. So होता क्या है कि आपका कार्टिलेज बाद में ग्रो होने लगता है और ये कार्टिलेज जो है ये कंटिन्यूज टू ग्रो नियरली आपके एडल्टहुड तक. सो 18-20 साल तक आपका कार्टिलेज कंटिन्यू करता है ग्रो करना. So what happens is that sometimes the cartilage does not get enough space to grow. So when the cartilage does not get enough space to grow, anteroposteriorly it will start growing laterally. So if I have to say कि मेरे पास में इतनी सी जगह है, उसके अंदर में मुझे इतने बड़े पेपर को एडजस्ट करना है, तो मैं कैसे करूंगा इसे को एडजस्ट? इसको मेरे को मोड़ना पड़ेगा, तभी ये एडजस्ट होगा. मोड़ा तो ये क्या हो गया? ये हो गया डेविएटेड नेजल सेप्टम, राइट? सो let us understand how this deviated nasal septum is formed. This deviation of the nasal septum, the most common cause of this deviation is birth trauma. Please remember everyone, the most common cause is birth trauma. What do you mean by birth trauma? Birth trauma means injuries that are happening during the time of birth. This can be because ऑफ इंस्ट्रूमेंटेशन. आपका जो बर्थ आपका हो रहा है उसमें कोई इंस्ट्रूमेंट यूज किया है जिसकी वजह से नोज के ऊपर में प्रेशर आ गया, या सिफेलोपेल्विक डिस्प्रपोर्शन है, तो आपका मान लीजिए द स्पेस इज नॉट इनफ एंड व्हेन यू आर ट्राइंग टू pull the baby out of the pelvis, at that time the nose gets pressed and because of that you have an injury. or during cesarean also, if you have मान लीजिए अपने स्पेस के ऊपर में ज्यादा प्रेशर दे दिया तो नोज प्रेस हो गया. So because at that time there is no fusion of bones and everything is very soft and supple, तो उस टाइम पे इंजरी होने के चांसेस सबसे मैक्सिमम होते हैं. बट आफ्टर बर्थ ऑल्सो यू कैन हैव इंजरी. मान लीजिए बचपन में सब अपन खेलते हैं ग्राउंड्स पे और किसी ने मारा, या अपन क्रिकेट खेल रहे हैं बॉल लग गई है या बैट लग गया है, या एनी काइंड ऑफ सच इंजरीज, हम खेलते खेलते गिर गए हैं और नोज पे चोट लग गई है, तो दैट कैन ऑल्सो गिव राइज टू डेविएटेड नेजल सेप्टम. सो that is one reason. So birth trauma is one cause. Trauma after birth is also another cause. And development के बारे में हमने क्या बात करी थी? डेवलपमेंट के बारे में ये बात करी थी कि the cartilages continue to grow even after the bones have stopped growing, and because of this the cartilage does not get sometimes enough space to accommodate in a small space, so the cartilage deviates itself. But the most common cause is which cause? The birth trauma. That you have to remember uh, definitely. Now, what are the different types of deviations that you can have? The first type that we are seeing over here is called as caudal dislocation or anterior dislocation. Remember, this is the anterior part of nose, this is the posterior part of nose, but the posterior part of the nose is a little higher. So we say anterior inferior and posterior superior. सो इसको हम एंटीरियर डिसलोकेशन भी कहते हैं और कॉर्डल डिसलोकेशन भी कहते हैं. इसमें नोज का जो सेप्टम है वो है तो स्ट्रेट, पर उसका अलाइनमेंट टेढ़ा हो गया है. सो एज सच इफ यू लुक एट द नोज विल लुक स्ट्रेट, बट व्हेन यू लिफ्ट द टिप at that time you will see that the anterior part of the septum is dislocated to one side. The other type is called as the C type. Depending on its shape, the C type can also be this type of septum. So just don't always think that the C has to be on the right side. It can be an opposite C also. So that what we want to say is there is a single curve in the septum. Then we have got an S-shaped septum, depending upon again the shape. So it can be like this or it can be like this, either which ways, but this is an S-shaped septum. So what we mean by S-shape? There are two curves to the septum. Then you have got the septal spur. Now this is the most common type of deviated nasal septum. Remember, the most common type of deviation is which type? The spur. And also the most problematic and also the most easily treatable. Now let us understand why this is problematic. This, if you can see, this is a sharp spur. इस sharpness की वजह से क्या हो रहा है? एक तो ये यहाँ के टर्बिनेट को टच कर रहा है. सो इट कैन आइदर टच, इफ इट्स अ लिटिल हायर अप, इट कैन टच द मिडल टर्बिनेट, और इट कैन टच और impinge on the lower inferior turbinate. Now when it impinges on the opposite side's turbinate, यहाँ की जो नर्व्स होती हैं वो आपकी कंप्रेस होने लग जाती हैं और वहां पे पेन उठता है. दिस टाइप ऑफ पेन इज वेरी कॉमनली कॉल्ड व्हाट टाइप ऑफ न्यूरalgia? दिस टाइप ऑफ पेन इज कॉमनली कॉल्ड एज अ Sludder's neuralgia. Sludder's neuralgia. Sludder's neuralgia is the pain that is occurring because of compression of the nerves on the lateral nasal wall by the septal deviation. So lateral nasal wall पे जो nerves है वो compress हो रही है क्योंकि septum उसको touch कर रहा है. That is called as Sludder's neuralgia. So that is one reason why this is a little problematic. The other reason is, of course, the mucosa over here is going to be very, very thin, and therefore even a slightest of injury or irritation can give rise to epistaxis. So epistaxis is very, very common, very, very common in a septal spur. All right. And the third important reason why this kind of spur is a problematic issue is because we had studied yesterday about something about the nasal valve. All right. So nasal valve क्या होता है हमारा? Let us quickly go back and understand into the different that diagram that we had seen yesterday. Nasal valve was this area of the nose where you had a angulation between the septum and the lateral nasal wall, the lateral cartilage, and this spur over here will reduce the angulation of the nasal valve which was already very less, it was a 10 degrees that we had, so वो और ज़्यादा narrow हो जाएगा and this spur is going to give rise to a lot of problem for us during the surgery. So this spur is, that is why, very very important. Let us go to the fifth type of septum, that is the thickening of septum. So there is a overall mucosal thickening. So it's a thick septum. There is no collection over here. It is a cartilage only, but a thick cartilage. So now when you have this, how will you diagnose? What will be the complaints of the patient? Of course, the patient is going to come to us with obvious complaint of nasal obstruction, क्योंकि उसका nose जो है वो obstruct हो गया है एक तरफ से. So if you can see if this side or this side, so this cavity is smaller. In this case, this cavity is smaller. In this case, this cavity is smaller. So nasal obstruction होगा, सांस नहीं आएगी अच्छे से. Pain will be another common complaint. So let us write down. So obstruction is one most common symptom. Pain is going to be another most common symptom. Pain can be because of headache or Sludder's neuralgia. Epistaxis can be one of the presentation. Epistaxis means bleeding from the nose. So that can be another presentation of the patient. And sometimes this patient can also have discharges or rhinitis. So we can have nasal discharge, mucoid discharge from the nose because of infections that can occur. One thing that I want to talk about over here, that we can see in the diagram also, if the septum is deviated to the, let's say this is the right side, this is the left side, you can very easily see that because this cavity is now very roomy, then the turbinates on this side become more enlarged or hypertrophied. Same thing you can see over here. There is a septal spur over here, but the inferior turbinate on this side is hypertrophy. This kind of a condition is called as पैराडॉक्सिकल ऑब्स्ट्रक्शन. पैराडॉक्सिकल ऑब्स्ट्रक्शन क्या होता है कि ऐसे जो सेप्टम का डेविएशन है वो तो राइट साइड पे है, लेकिन बिकॉज टर्मिनेट्स आर हाइपरट्रोफिड ऑन द लेफ्ट साइड, द लेफ्ट साइड आल्सो पेशेंट इज गोइंग टू हैव नेजल ऑब्स्ट्रक्शन. सो दैट इज कॉल्ड एज पैराडॉक्सिकल ऑब्स्ट्रक्शन. ऑलराइट, हाउ आर यू गोइंग टू इन्वेस्टिगेट दिस पेशेंट? जब पेशेंट आया आपके पास में तो आप क्या करेंगे? सबसे पहला काम तो आप करेंगे उसकी एंटीरियर राइनोस्कोपी करेंगे. Right, so anterior rhinoscopy आप करेंगे via thadicum's nasal speculum and you will check that where is the deviation. You can also do, of course, anterior rhinoscopy or nasal endoscopy. We call this diagnostic nasal endoscopy, that can be done. You can do a test that is called as Cottel's test. Cottel's test क्या होता है हमारा? हमने कल देखा था nasal valve अगर आपका बंद है तो आप क्या करेंगे? चीक को पुल करेंगे laterally and upwards. So when you will pull the cheek upwards, the cartilage will get pulled. Bone को तो कुछ नहीं होगा, bone is going to stay there only, but this cartilage is going to get pulled. So when the cartilage will get pulled, the nasal valve angle will open up and that will relieve the obstruction. So that is called as Cottel's test. If Cottel's test is positive, that means you have a problem with the nasal valve and you need to correct that area. And the third thing you can do is something called as a cold spatula test. Cold spatula test. Cold spatula test क्या होता है? अपना ये tongue depressor होता है. We have got a tongue depressor. I'll just show you. This is the tongue depressor that we commonly use to depress the tongue. हम इसको थोड़ा सा ठंडा कर देते हैं. And when we ask the patient to breathe out, so when the patient breathes out, there is going to be misting on this spatula. अगर आपको लग रहा है कि एक तरफ का जो मिस्ट है वो दूसरी तरफ के मिस्ट से कंपैरेटिवली कम है उसका एरिया, देन दैट इज कॉल्ड एज अ पॉजिटिव कोल्ड स्पैचुला टेस्ट. सो मान लीजिए अगर ये वाला नोज है तो यहाँ का जो आपका स्पेस है ना, दैट इज गोइंग टू बी, this space is less than this space. So when you keep a tongue depressor here, then misting over here will be less than misting over here. So that is your cold spatula test that you can do to confirm your test. Of course, you can also do the most common investigation, that is your CT scan of the paranasal sinus or the nose, CT-PNS, where you will get the exact location and the deviation. How are you going to treat it? To treat it, you are going to do septoplasty or SMR. Let us understand the difference between the two by understanding this diagram over here. Now we are looking through the nose. हम एंडोस्कोपी यहीं से करने वाले हैं, तो आई एम कीपिंग दिस डायग्राम. दिस इज द नेजल वाल्व एरिया. यू रिमेंबर दैट. What we are discussing right now is septoplasty versus SMR. Septoplasty versus SMR. SMR is submucous resection and septoplasty is of course the correction of the septum. So what we do in SMR, ये हमारा कार्टिलेज है. दिस इज अवर कार्टिलेज and this is the mucoperichondrium over here. This is the mucoperichondrium. So what we do is we give one incision here and one incision here, और दोनों तरफ से हम इस म्यूकोपेरिकॉन्ड्रियम को लिफ्ट करेंगे और इस पूरे सेप्टम को हम निकाल देंगे. ठीक है. What we are going to leave behind is just the tip of the septum so that nasal deformity ना हो. Right? So this is called as SMR. So in SMR, incision is bilateral. This incision is called as Killian's incision when we give it bilaterally, and we are going to lift bilateral mucoperichondrial flaps, and we are going to remove the entire septum, keeping behind an L-shaped strut. Okay, so that is your septoplasty. That is your SMR. How about septoplasty? In septoplasty, you are going to give only one incision. Alright, this incision is called as the Freer's incision. सिर्फ यहीं से हम म्यूकोपेरिकॉन्ड्रियल फ्लैप उठाएंगे और यहां से जो हमारा डेविएटेड पार्ट है, मान लीजिए हमारा एक स्पर है इस सेप्टम के अंदर में. If this is the spur, then this mucoperichondrium we are going to remove, and we are going to only remove the deviated part. That is it. We are not going to touch any other part of the septum. So what we do, the incision is given unilateral. This is called as the Freer's incision. Unilateral flap is raised. Unilaterally the flap is raised, and only the deviated part of the septum is removed. Only the deviated part of the septum is removed. The rest of the septum is left behind. All right, rest of the septum is left behind. It is but obvious. It is but obvious that complications कहाँ पे ज़्यादा होंगे और कहाँ पे कम होंगे. Of course, when you are doing surgery on both the sides, at that time what is going to happen is हमने यहां से भी फ्लैप उठाया है, यहां से भी फ्लैप उठाया है और पूरा कार्टिलेज निकाला है, तो एक तो चांस ये होगा कि ये पूरा का पूरा नोज नीचे सैडल डाउन कर जाए. सो सैडल नोज डिफॉर्मिटी कैन अकर. दिस इज कॉल्ड एज सैडल नोज डिफॉर्मिटी. और या फिर ये भी हो सकता है कि आपने दोनों तरफ से ये जब फ्लैप उठाया तो ये फ्लैप वापस चिपका ही नहीं और यहाँ पे एक परफोरेशन हो गया. सो यू कैन एंड अप हैविंग अ सेप्टल परफोरेशन. और what you can end up is that ये आपने फ्लैप उठाया और क्योंकि कार्टिलेज पूरा निकाल दिया अंदर का, अब यहाँ पे आपका ब्लड या पस इकट्ठा हो जाए. सो यू कैन एंड अप हैविंग अ septal abscess. This is called as a septal abscess or a septal hematoma. All right, so these are the common complications, but these complications are common with SMR. These complications do not occur commonly with septoplasty. So these are the differences between septoplasty and SMR. Remember that. All right. Now, once we have understood the technique of septoplasty and SMR, once we have understood the technique of septoplasty and SMR, let us go into a little bit into the detail of the complications of septoplasty and SMR. All right. So I'm going to rub this and I'm going to go a little bit, just 1 or 2 lines about each complication that we're going to discuss right now. The first complication that we're going to discuss about is your septal perforation. Septal perforation. What happens is आपने यहाँ पे से फ्लैप उठाया, यहाँ से फ्लैप उठाया, ये दोनों फ्लैप आपस में जुड़ गए और यहाँ पे बीच में एक परफोरेशन रह गया. As such, perforation is not going to cause any kind of problem, but when the patient breathes, there is going to be dryness and crusting, and that you can remove, that you can reduce by a septal button. So आजकल silicone rubber के buttons आते हैं that you can put. You can also do a surgery. You can take a flap from the floor of the septum and lift it up and close the septal perforation. So that can be done. So you can either use a button or you can do a flap reconstruction. So that is another option you have. Second is your septal hematoma or a septal abscess. सेप्टल एब्सेस. सेप्टल हेमेटोमा और सेप्टल एब्सेस में क्या होता है, क्योंकि आपने यहाँ से पूरा का पूरा ये सेप्टम हटा दिया है तो यहाँ पे ब्लड कलेक्ट हो जाएगा. ब्लड कलेक्ट होगा तो वो नेक्रोसिस करेगा और सैडलिंग कर सकता है, एंड ऑफ कोर्स पस कलेक्ट हो गया तो पूरा इन्फेक्शन हो जाएगा. एंड रिमेंबर द एंटीरियर पार्ट वाज द डेंजर एरिया ऑफ द फेस, so the infection can go to the cavernous sinus. So that is a big problem for us. Okay, this is a danger area, and this patient will have may have a problem with the cavernous sinus, and this needs to be drained. The only option you have is drainage. To avoid this kind of thing, what you can do is you can use a septal splint. तो हम क्या करते हैं, एक splint आता है, जैसे it's like a rubber material, you can use x-ray film, प्लास्टिक मटेरियल, आप उसको ऑपरेशन करने के बाद दोनों तरफ डाल के और इसको अच्छे से टाइट सूचर कर दो. So when you suture it tightly, what will happen? It will prevent any kind of infection. And the third thing that we talked about was the septal सैडलिंग और सैडल नोज डिफॉर्मिटी. सैडल नोज में क्या होता है, ये जो टिप ऑफ द नोज है या ब्रिज ऑफ द नोज है, ये नीचे बैठ गया बिकॉज यू हैव रिमूव्ड द एंटायर सेप्टम, जस्ट लीविंग बिहाइंड स्मॉल पार्ट ऑफ द सेप्टम. सो सैडल नोज हो सकता है. तो इसका ट्रीटमेंट तो कुछ भी नहीं है. यू हैव टू डू अ राइनोप्लास्टी. यू हैव टू पुट अगेन अ सेप्टम हियर by taking a cartilage from the conchal area or a rib cartilage and put it over there. Okay, so ये तो हो गया हमारा सेप्टोप्लास्टी एंड डीएनएस के बारे में. The next thing we are now going to end up with is your blood supply and the nerve supply of the nose, of the septum actually we are going to talk about. So what happens in the about the blood supply of the nose, of the septum. हमारा जो ब्लड सप्लाई है वो कैरोटिड आर्टरी से आता है. सो फ्रॉम द एक्सटर्नल कैरोटिड आर्टरी यू गेट टू ब्रांचेस. यू गेट मैक्सिलरी आर्टरी एंड द फेशियल आर्टरी. This facial artery is going to give rise to superior labial artery, which is going to supply the lips ultimately, but that will give one branch that is called as your superior, the septal branch of superior labial artery. So this is one branch. So let us keep in mind superior labial artery. Then coming to the maxillary artery, you remember is going to go back. हमने juvenile nasopharyngeal angiofibroma में पढ़ा था कि ये आपका pterygopalatine fossa में जाके और फिर ऊपर जाएगी. This maxillary artery is going to give one branch to the nose, that is your sphenopalatine artery, and one branch that is your greater palatine artery. So these are the other two arteries that are very important, sphenopalatine and greater palatine. Sphenopalatine gives the maximum blood supply. So the most important artery of all is sphenopalatine artery. Then we have got the internal carotid artery. जो internal carotid artery है हमारी, वो हमारा ophthalmic artery देती है, और हम ophthalmic artery जो है उसकी branch निकलती है anterior and posterior ethmoidal artery, which pierces from the medial wall of orbit and enters into the nose to give two branches, anterior ethmoidal and posterior ethmoidal. Now of these arteries, the anterior ethmoidal arteries comes and forms a plexus with these three arteries, which is called as the Little's area, or also called as the Kisselbeck's plexus. Kisselbeck's plexus. All right. Whereas posterior ethmoidal artery is not forming a part of this plexus. Can you see this posterior ethmoidal artery? So remember this, the four arteries that form the part of Kisselbeck's plexus is anterior ethmoidal, superior labial, greater palatine and sphenopalatine. Posterior ethmoidal does not give rise to any kind of epistaxis. It gives rise to epistaxis, but not in the Little's area. All right. But other way around, अगर question आ गया कि which of the following is not a branch of external carotid, then one of the option can be anterior ethmoidal. So you get these four options: anterior, superior, posterior, greater palatine, and you get a question which of them is not a part of the external carotid. Then anterior, posterior, both are not parts of external carotid. So understand what the question is asking, whether it is asking which arteries contribute into Kisselbeck's plexus or which arteries form your branches of anterior ethmoidal and external carotid or internal carotid. So that you have to understand, then you will be able to answer the questions very easily. All right. Once we have understood this part, then the other option that we have is the nerve supply of the nose. The nerve supply of the nose is by the septum is mainly via the trigeminal nerve, that is your nasopalatine branch of the second part, maxillary branch of the trigeminal nerve, V2. All right. And you have also got cribriform plate. We saw the ethmoid which is forming the skull base. So वहां से आपके olfactory bulb भी जा रहा है जो आपका first cranial nerve है, right? and you've got the ethmoidal nerve, which is a branch of the ophthalmic branch of trigeminal. So the main sensory nerve supply that you have, the main sensory nerve supply that you have to the nasal septum is by the trigeminal nerve, and olfaction is occurring via the olfactory nerve. All right. So trigeminal is your fifth nerve, and this is your first cranial nerve. All right. Why you should know about the nerves? You should know about the nerves for two reasons. First reason that you should know about the nerves is because if you are going to have any kind of mass over here, or a polyp over here, then it is going, the patient may have anosmia. Patient may not be able to breathe because sensations are not going up. All right. Or the patient can have facial pain because of pressure over the V2 nerve. Also, इफ यू हैव डेविएशन, हाई डेविएशन, जो हमारा नेजल वाल्व एरिया था वहां पे अगर आपका डेविएशन है, हाई डेविएशन है, देन अगेन योर olfactory nerves are going to get affected. And third, from this trigeminal nerve itself can a tumor arise, which we call as a schwannoma or a neurolemoma. All right. So a septal schwannoma, although rare, has very commonly been, I mean, it is encountered whenever you do surgeries. So one of the cause of unilateral nasal masses is also a septal schwannoma. So a tumor arising from the nerve itself can give rise to problem. Olfactory epithelium, also a tumor can arise, and that tumor we call this as esthesio neuroblastoma. All right. So you can have tumors arising from olfactory epithelium and tumors arising from the trigeminal nerve itself, and these are schwannomas and esthesioneuробlastomas. So that is why understanding the nerve supply is important. I hope you are able to understand entire concept of the septum. What you need to remember first about the condition of the septum, that is called as membrane, I mean the parts of the septum, that is membranous, columnar and septal proper. Deviated nasal septum, its type, diagnosis and treatment. Differences between septoplasty and SMR is the favorite question for all the examiners for undergraduate and postgraduate level. The blood supply and the nerve supply of the nose. Now, if you have understood the blood supply of the nose, then what you should also remember is something about epistaxis. All right, something about epistaxis. So we're going to remember, we are going to study a little bit about the epistaxis over here. All right. Let us keep in mind that this area can bleed. Remember, the most common cause of epistaxis, I mean the site of epistaxis, is Little's area. Now, whatever condition is given to you, whether you are talking about a young child, whether you're having a patient of 70-year-old, whether it is hypertensive, patient is on antiplatelet, patient is having any coagulopathy, any disease, pregnancy, so any condition, the most common site. So कोई क्वेश्चन में अपने को घबराना नहीं है, कंफ्यूज नहीं होना, कारण चाहे कोई भी दिया हो, site is going to remain the same, and that is your Little's area. All right. How are you going to manage this? It's a very common thing, and I am going to discuss this with you on a clinical basis. So when a patient comes to you, या आपके मान लीजिए घर पर ही किसी को nasal bleeding हो गई है, तो आप क्या करेंगे? The first step that we do is the position. So what we do is हम नाक को पिंच करके बैठ जाएंगे आगे होके, सोना नहीं है. सोएंगे तो क्या होगा? ब्लड पीछे ट्रिकल डाउन करेंगे and you may have aspiration. So the first thing that you will do is the position of the nose, position of the patient, and that is called as the trotter's position. Trotter's position. Trotter's position क्या होती है? It is to pinch your nose and sit in front. For how much? How long should you pinch the nose? At least 5 minutes, because that is the clotting time. So आपको allow करना है blood को clot करने के लिए. That much time you are also buying so that you can go to the, I mean, arrange and go to the nearest hospital available. The second thing that you can do, of course, along with protestat, आपने सुना होगा घर पे कि ठंडा पानी डाल दो, बर्फ डाल दो सर पे. It is not wrong. By reducing the temperature, there occurs vasoconstriction, and vasoconstriction से bleeding बंद होती है. So you can apply cold water or ice on the nose to reduce that local temperature and cause vasoconstriction. But you must completely pinch your nose and apply pressure. The second thing that you can do is something called as cauterization. Cauterization क्या होता है? ओके, बिफोर गोइंग इनटू कॉटराइजेशन, आप मान लीजिए हॉस्पिटल पहुंच गए हैं. तो जब आप हॉस्पिटल पहुंच गए, द फर्स्ट थिंग दैट द रेसिडेंट माइट डू इज अप्लाइंग some chemical over here that is called as chemical cauterization. Cauterization का मतलब होता है to burn that area. Now you can burn that area by using a chemical like the commonest ones that we use in our setups is silver nitrate. That is the most common chemical that is used. Copper sulfate is another chemical that is commonly used by gynecological people to reduce PPH. But in ENT, we do not use copper sulfate because it burns with fumes. So it can burn the nearby mucosa also. So हम usually copper sulfate नहीं use करते, हम silver nitrate use करते हैं. The other thing that you can use is drugs. Drugs का मतलब क्या होता है? The drugs that will reduce, your bleeding and cause coagulation. So common drugs that you know of is, one is tranexamic acid, and one is ethamsilate. So these are the common drugs that you can use for causing clotting over there. The third thing that you can do is your इलेक्ट्रोकॉटराइजेशन का मतलब क्या होता है? कॉटरी मशीन आती है, उससे आप बर्न कर दो. पर ये हम यूजुअली इजीली नहीं यूज करते. क्यों? क्योंकि मान लीजिए पेशेंट का बीपी है 200/120 millimeters of mercury. But if you cauterize on one point, let us say there is a bleeding here, and you cauterize this, BP is high, so it will start bleeding from here. You cauterize here, it will start bleeding from here. You cauterize here, it will start bleeding from here. So कहने की बात क्या है कि आपको ट्रीट द कॉज तो करना ही पड़ेगा साथ में. एंड कॉटरी इज नॉट अ वेरी इजी थिंग. यू नीड लिटिल एनेस्थीसिया फॉर इट ऑल्सो. So before doing cautery, somewhere over here I will introduce one more point, that is your nasal packing. All right, that is more commonly used. What is nasal packing? आप अगर ओल्ड टेक्स्ट बुक्स कोई पढ़ेंगे तो उसमें ऐसा बताया होता है कि रिबन गॉज होता है, एक लंबा गॉज पीस लो, उसको पैराफिन में डिप करो और उसको ऐसे 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 पूरे नोज में पैक कर दो. बट दिस इज अ वेरी लॉन्ग प्रोसेस, इट कैन कॉज ट्रॉमा इटसेल्फ. और एक तरीका दिया है कि आप वर्टिकली उसको पैक कर सकते हो. बट व्हाट वी डू नाउअडेज इज समथिंग कॉल्ड एज मेरोसील. मेरोसील इज अ सेल्यूलोज. इट इज अ सेल्यूलोज मतलब जो हम गेहूं होता है ना, अगर उसको आप रात को पानी में भिगो दो क्या होगा? फूल जाएगा. सो सेल्यूलोज क्या होता है? यू पुट अ स्ट्रिप इन द नोज एंड यू apply some saline on it or some water on it. It will swell up and it will occupy the entire nose. It is a very quick, effective and easy technique. It's a small strip, insert in the nose, apply some water, it will swell up. So that is called as anterior nasal packing. आपने फोलीज कैथेटर देखा है? तो यू कैन यूज अ कैथेटर, पास इट इनसाइड. दैट कैथेटर हैज गॉट अ बल्ब ओवर हियर एंड इट हैज गॉट अ पॉइंट ओवर हियर फ्रॉम वेयर यू कैन इंसर्ट सलाइन. सो आप जब यहां से सलाइन डालेंगे तो यहां पे क्या होगा? वो जो बल्ब है वो फूल जाएगा. सो दैट विल ऑल्सो प्रिवेंट द ब्लड फ्रॉम गोइंग बैकवर्ड्स एंड दैट इज कॉल्ड एज पोस्टीरियर नेजल पैकिंग. सो पोस्टीरियर नेजल पैकिंग, हम एंटीरियर और पोस्टीरियर नेजल पैकिंग किससे करते हैं ये चीज आप याद रखिए. आजकल हम एंटीरियर पैकिंग करते हैं बाय यूजिंग अ मेरोसील एंड पोस्टीरियर पैकिंग बाय अ बलून कैथेटर. ऑलराइट, सो बाय यूजिंग अ बलून कैथेटर. लास्टली, अगर ये सब करने के बाद में भी ब्लड नहीं बंद हो रहा, then you can ligate the sphenopalatine artery. It is called as ESPAL, endoscopic ligation of sphenopalatine artery, or you can ligate the external carotid. Internal carotid को ligate नहीं करना क्योंकि it is also supplying the brain. So we are going to ligate the external carotid artery. So this is exactly how you are going to manage a patient of epistaxis, right? Apart from this, of course, treat the cause. So अगर पेशेंट को कोएगुलोपैथी है या पेशेंट को हाइपरटेंशन है या एंटीप्लेटलेट ड्रग्स पे है तो उसको पहले एलिमिनेट कर दो. उसके बाद में ये सारी चीजें तो आपको करनी ही करनी है, राइट? सो that completes our entire concept of nasal septum and its diseases. its blood supply, its arterial, its nerve supply, and the different anatomical aspects of septum. In the next video, we are going to talk about the lateral nasal wall and rhinosinusitis. So stay tuned. Thank you.